Dog Therapy Interactions Support Elderly Mental Health by Kaplan and Nura. The outline to this research includes the introduction, what is mental health, and the research question. The background includes research to be conducted and its importance, surrounding studies, future studies, and access to care and costs. This also includes the objective, methodology, which includes study design, subjects, the inclusion and exclusion criteria, and measurements, along with statistic issues, ethical issues, and research limitations. What is mental health? What comes in mind when you think of mental health? Personally, when I used to think of mental health, the first to populate would be Alzheimer's and dementia. However, mental health encompasses many health disorders that pertain to an individual. Mental health is the well-being of an individual with the capacity to manage typical tensions one may experience while maintaining productivity, with the processes of thought, interaction, work capacity, and enjoyment. The unfortunate reality to poor mental health is the discrimination and stigma individuals face regularly regardless of their true capabilities and intellect, along with the lack of resources individuals face in low-income countries as opposed to wealthier countries. Determinants of mental health factors proliferate through numerous biological, psychological, and social vectors. Encouragement and defense of mental health demands for optimal conditions of an environment for nourishment, which will translate to overall improvement of all aspects of health. Common mental health disorders include anxiety and depression. An anxiety disorder is a mental health disorder when an individual experiences irregular volumes of anxiety and distress. Depression is a state of abnormal sadness without an apparent reason or more severe sadness experienced due to external events. Anxiety and depression are one of the most infamous forms of mental health. It affects 1 in 5 people, along with approximately 30% of non-global disease burden. Research question. The research question proposed in this study is, does the daily exposure of a dog for 20 minutes in public outdoor leisure areas benefit elderly individuals 67 to 75 years, clinically diagnosed with mild anxiety and depression, who are living with company in retirement homes? Using the depressive anxiety stress scale, will elders experiencing dog therapy see greater benefit than elders that may participate in social interactions with one another on indoor or outdoor walks for 20 minutes? Social connectedness has shown to influence psychologic symptoms. The purpose of this intervention is for participants to experience social connectedness, monitored through the routine testing conducted with DAS tests. In the next 10 years, how old will your parents be? Research to be conducted and its importance. This research mediates toward elders in retirement facilities with the use of a dog for the purpose of social interaction for a limited duration daily, compared to elders that are in retirement homes not participating in the interaction with a dog. Prior to the introduction of this social interaction, elders will be assessed, and post-interactions with assessment tools used in past research to study changes in anxiety and depression. Each individual follows the depressive anxiety stress scale, which has shown effectiveness since 1995. Dog therapy is a cost-effective method to support mental health. A simple investment of $1 US leads to a return on investments of $4. Curative and rehabilitation pillars of health are expensive as opposed to promotion. Prevention and early intervention that demonstrate greater returns on investment. Globally, mental health disrupts approximately 10% of the population, specifically cases of anxiety and depression that accumulate to nearly 50% of increase from 1990 to 2013. A simple factor is advancement of technology through better forms of detection. Surrounding studies. The study facilitates management of mental health, specifically in elder populations within the ages of 67 and 75. They are not necessarily dog owners, but they choose to partake in short durations of 20 minutes daily to see changes in their mental health in terms of anxiety and depression. This study will not be looking at other dimensions of health like past researchers that facilitate research to physical health. A lot of research has been directed to physical health, which is simply understandable. One that has a dog is more inclined to walk their dog as it provides physical activity. Prior studies generally manage younger age groups to measure physical health aspects and broad mental health in terms of blood pressure, sleep, cholesterol, and heart problems. Dogs facilitated to serve rehabilitation for young male offenders as measures demonstrate positive outcomes in behavior, emotional management, enhancement of motivation, and self-efficiency. These psychological changes were mediated to support young male offenders. In the past, students have received support with dog therapy while attending school to ease mood and anxiety. Small intervals of 20 minutes with a dog and their handlers has shown significant improvement in students' mental health while attending university, which affected their school performance. Students see an improvement in their performance following 20 minutes of interaction with dogs in their mental health that translate into better school abilities. Future research. Elders in the proposed study are not the largest population of elders projected. Generation Y is the largest population of elders to come as they pertain to births post-World War II, when fertility was at its climax. Managing the current population of seniors will aid in the future development of support, reduce costs of counseling, medications, and treatment. Future research should facilitate larger population group, and current statistics illustrate growth in senior demographics. Fertility has substantially reduced in the past decades, so young populations is not significant as opposed to elder groups of population. Future research should practice the access of healthcare in consideration of age group. Older populations have difficulty seeking support, so allowing the easy access would prove benefit as opposed to developing higher costs in medications and treatment. Access to care and cost. A stigma is attached to the treatment of mental care most people experience, which shows improvement over time. Canadians aged 15 and older report a third of the population that sought support did not experience optimal health. Data extracted from this survey from 2016 conveys 40% of participants did not seek medical aid while facing anxiety and depression. However, counseling therapy tends to demonstrate long wait times from 6 months to a year. The cost of mental health illness in Canada is remarkably high. Studies among 36 countries estimates the cost of mental health services including counseling, medications, and treatment, are expected to be 147 billion from 2016 to 2030. However, return on investments are expected to be $809 billion. It is similar to the flu shot investment. Mental health demonstrates unanimous return on investments. Objective. The scope of this research includes elders the ages of 67 and 75 years. This is a significant age group of elders to record as they are the highest population of children in the baby boomers era. This era held the greatest number of birth rates, and it began to reduce through the early 60s. Allocation to resource must be contributed according to the population volume, not simply life expectancy. The baby boom of 1946 to 65 was an era with sudden rise of births, which is the greatest number of births seen since 1921. The average number of births was approximately 412,000 per year compared to 2008, with an average household would generally experience childbirths of 1.7 children. The growth of the elderly population, with an estimated of 23% of the population by the time of 2031. Study design. This cross-sectional study, it is a 6 months in duration, and the intervention is a 20-minute daily process. The blinding occurs through patients' minimal knowledge of the intervention benefit. The purpose of the study is to understand population needs for a time interval through exposures and outcomes. The goal outcome is for elders to benefit from dog therapy and to compare the results of elders walking 20 minutes daily, either indoor or outdoor, with social interactions. There will be weekly questionnaires provided by trained staff that are previously accustomed to residents. Each individual follows the Depressive Anxiety Stress Scale, which has shown effectiveness since 1995. Subjects' inclusion and exclusion criteria. Inclusion criteria include elders following the age limit clinically diagnosed with anxiety and depression living in retirement homes. Tolerance for socializing with a dog and physically capable of walking. Capacity to articulate feelings and thoughts are collected. Currently not receiving other forms of medical intervention to rehabilitate mental health. Dogs will be hypoallergenic, up to date on vaccinations, and well trained. Individuals are social, having spouse or company with at least mild to regular communication. Participants volunteer to join each interventions from a retirement home. This will occur after understanding their specific allergies to assure participants are not allergic to saliva and protein from hair molecules of dogs. Dogs are chosen for participation are groomed, hypoallergenic, trained, and vaccinated. Exclusion criteria are that excluded those outside the age range, as older individuals face more life events, which will have a toll on their mental health, and the goal is to strengthen it from the very beginning. Those that are allergic to dogs and saliva and protein from their hair experience exclusion from this dog therapy intervention, along with participants from certain religious groups. Recruitment of participants will be voluntary to join each intervention from a retirement home. This will occur after understanding individual allergies to assure participants are not allergic to saliva and proteins of dog hair molecules. Dogs are chosen that must be groomed, hypoallergenic, trained, and vaccinated. Predictors of effectiveness are individual level of initiative, interaction during interventions, along with the level of socialization prior to old age. The exposure. 20-minute interactions with a dog for therapy that is mediated by an owner or trainer, and in an indoor or outdoor walks for social interactions. Outcome. Surveys are conducted to display the changes in levels of anxiety and depression through the DASS tests. Statistical issues. Hypothesis. Elders that are experienced more communication and socialization in the past are likely to excel in interventions as opposed to elders that are introverts. The analytic approach. Strong communication is proportionate to good mental health, demonstrating an effective level of communication and participation in the intervention groups correlates with anxiety and depression experienced. The higher level of communication and participation, the greater the improvement in mental health. Social connectedness has shown the influence of psychological symptoms. The purpose of this intervention is for participants to experience social connectedness, monitored through routine testing conducted by DASS tests. Ethical consideration and addressing concerns. So ethical considerations include the interaction of dog therapy may impede certain religions, as Muslim cultures are stern about having dogs in living areas. Dogs must be up to date on vaccines. There must be warm environment to control the intervention in regards to winter. Participants' lack of knowledge on allergies such as dead skin cells, saliva, and urine. Address concerns. There will be individuals that cannot partake in the intervention, but the comparison group is catered to the inclusive to any religious belief. Owners must have their dogs vaccinated in a timely manner. Their history of vaccines is provided prior to interaction. During poor weather conditions, interactions are present on the basement floor to minimize exposure to others in terms of dead skin cells, saliva, and urine. To combat urine, dogs are to be walked prior to interactions, especially when indoors. And to minimize dead skin cells, dogs are to be groomed prior to interactions. And the basement floor must be cleansed post-interactions. Medical history of participants will be collected to understand allergies of each individual. Limitations of research. The limitations of this research includes the level of compliance an elder follows with staff. They must be compliant in order to interact with dogs. Communication level of elders must be adequate, and they must show initiative in the comparison group for communication and not simply walking around for 20 minutes. Elders are to show a moderate level of interactions with dogs in the intervention group as well. Participation should be at least at a moderate level, and it should not be wasted. Showing initiative is a must. The final limitation is the validity of responses. Elders must be completely honest, which reasons for staff to perform the questionnaire as opposed to outside social workers. That is all of limitations and this presentation. Thank you for listening.